Good afternoon, and thank you for joining us for Understanding Adolescent Behaviors and Attitudes to Help Fight COVID-19. This is our final webinar of 2020. Thank you to those of you who have joined us throughout this seminar series. And we are pleased to be joined with a panel of experts on COVID and on adolescent behavior. If you do have questions for the panelists today, please submit those via chat and we'll get to as many audience questions as we can. With that, I'm happy to turn it over to Dr. Jermaine Lewis.
Good afternoon, everyone, and welcome to the final seminar in our webinar series highlighting COVID-19. As many of you know, attention to adolescents during this global pandemic is very important. They are a valuable yet unique population subgroup, and so I, for one, am looking forward to hearing and learning more about how we can engage adolescents in responding to the needs to contain COVID-19. So today, it's my great pleasure to introduce our two speakers in this session. Our first speaker is Dr. Nicole Beadles, and she is the Academic Program Coordinator for the School Psychology Program at George Mason University. She is a nationally certified school psychologist and licensed clinical psychologist. Dr. Beadles has spent more than a decade working in local public schools here in Fairfax, Montgomery, and Howard counties, as well as internationally in Geneva and Brussels. She has also worked in the neuropsychology department at the University of Virginia Hospital, and she's also worked in various residential and outpatient settings. Throughout the years, Dr. Beadles has focused her teaching and practice on helping children and adolescents with their academic, social, and emotional needs. She has taught classes in lifespan development, developmental psychopathology, social, emotional, and behavioral assessments, and ethics in law for school psychologists. All that expertise just underscores the many complexities underlying adolescence. She also supervises graduate students who complete psychoeducational assessments at the George Mason University Center for Psychological Services. Dr. Beadles graduated from Georgetown University with a Bachelor of Art degree in psychology and a minor in Italian. She continued her study of psychology at the James Madison University, where she received her master's and educational specialist degrees in school psychology. After working for a number of years in the schools, Dr. Beadles earned a doctoral degree in clinical psychology from the University of Virginia. Welcome, Dr. Beadles, and thank you for participating today. Our second speaker is Dr. Amira Roess, who is a professor in the Department of Global and Community Health in the College of Health and Human Services at George Mason University. She is an infectious disease epidemiologist with expertise in the evaluation of interventions to reduce the transmission and impact of infectious diseases, including COVID. Dr. Roess currently oversees several longitudinal studies to understand the emergence and transmission of zoonotic infections globally, including the emergence and transmission of MERS-CoV infection, as well as the development of the microbiome during the first year of life. At Mason, Dr. Roess has been involved in many aspects of our safe return to campus and in managing COVID at Mason. Currently, Dr. Roess advises school districts and businesses about how to safely reopen during the pandemic. Dr. Roess has an earned doctoral degree in global disease epidemiology and control from the Johns Hopkins University. She previously served as a scientific director for the Pew Commission on Industrial Food Animal Production at Johns Hopkins and was an Epidemic Intelligence Service, or EIS, officer at the Centers for Disease Control and Prevention. She has a master's degree from Rutgers University School of Public Health, and we're delighted to have her join us this morning, or this afternoon, sorry, as well. Thank you both. So the format for today, we will be hearing from each of our speakers who will give a short background on their topics and some conversation between our speakers. And then we'll be inviting questions from our audience for our speakers to respond to. And just as a reminder, if you would please put your questions into the chat, that will be great. And our moderator will be presenting those questions to our speakers. Thank you both.
Thank you for including me in this and that kind introduction, Dean Lewis and Michelle. So what I'd like to talk about right now is the current situation and what we know about COVID and adolescents. And adolescents are those children or young adults between the ages of 12 to 18. There are several well-known outbreaks that have been traced back to this adolescent age group, the 12 to 18-year-olds, and some studies have even suggested or shown that 12 to 18-year-olds are twice as likely to have COVID compared to the younger ages of 5 to 11. So, there's a lot that we really have to think about when we consider socializing with this age group and what schools look like and how to safely have children more engaged in school and in social settings. Because of a lot of the school closures, we are concerned about the rising inequities in health, in education, and in development among the 12 to 18-year-olds. And at this point, we've really been able to document this growing disparity, especially between children or adolescents who are from disadvantaged backgrounds, who are in low-income settings or are in minority groups. The other thing that we're documenting more and more is the mental health impact of COVID on the 12 to 18-year-olds. Before COVID, suicide was the second cause of death among young adults and among this age group. And now we are really concerned that we're going to see an increase, and there are some emerging anecdotal evidence that is suggesting that, we already are seeing an increase in suicide, in mental health issues, depression, anxiety, OCD, some substance abuse. We've seen an increase in that among young adults and among the teenage age groups. So there's quite a bit of challenges ahead of us when we're dealing with COVID and its impact on adolescents, not just COVID directly, but all of these other really significant public health and developmental and educational areas. I think we understand that adolescents are the least likely to have severe COVID disease. It's not a hard and fast rule. But because of that, there is a lot of discussion about having children go back to school and be in person for more than half the week. And we've seen in other countries, especially in parts of Western Europe and in parts of East Asia, that there has been an emphasis in getting children in school, especially in that 12 to 18-year age group. And we're learning a lot about what that means for outbreaks in the community. And, there are a couple of things to keep in mind when we're thinking about having the 12 to 18-year-olds go back to school. There's some evidence now that among the 12 to 18-year-olds, you tend to see less compliance with wearing masks and physical distancing than with the 5 to 11-year-olds. And that's developmentally consistent with what we know about 12 to 18-year-olds and even young adults. They're more apt to engage in risk-taking behavior, defying authority, those sorts of things. But at the same time, we've seen some really great examples of 12 to 18-year-olds, having a subculture where they're really encouraging each other to wear masks and to comply with physical distancing guidelines. So there's a lot in that area to further understand, especially as we're looking at going back to more in-person activities in the spring. And, I think it's also important to recognize that one of the challenges with having our 12 to 18-year-olds engage in in-person activities is that they're not living in a bubble, and they are more likely to be asymptomatic or pre-symptomatic carriers, which means that they could easily, and we've seen this documented, transmit the virus to household members, to other individuals that they come into close contact with. And the reality is we have a very large percentage of our adult population that does have underlying conditions that makes them at risk for severe COVID. And so that has to be taken into account and balanced as we consider how do we have our 12 to 18-year-olds engage in more in-person activities as safe as possible for them and for those adults that they interact with, whether they're teachers, staff, and others. And I think it's also really important to consider that when it comes to in-person activities, we really do know how to do this safely. At this point, we know that masks and physical distancing are really critical interventions. And if we have high compliance of these mitigation strategies, we end up with a very low probability of infection and outbreaks and spread. One of, I think, the biggest challenges and unfortunate stories of the last year is that despite this, very solid empirical data about how these mitigation strategies work, we still have a fairly large percentage of our adult population that really refuses to comply. And that has a downstream effect because, what that ends up doing is creating the outbreaks that we're seeing here. And so I think we all have to keep that in mind, especially as we consider, what does resuming or maintaining in-person activities for 12 to 18-year-olds mean in the spring when you still have a fairly large percentage of your adult population that aren't complying with the recommendations to wear the masks and to physically distance. And I think, finally, what will happen with the vaccine in 2021 is really going to change how we're operating and how we're dealing with the outbreak. And, there's a lot of hope that by the fall, adolescents will be able to get the vaccine depending on what the clinical trials show us. And that can really change how we handle the next fall's school year. But we do also have to keep in mind that even when a fair number of us start to get the vaccine, we're going to still rely on those basic, very simple practices of wearing masks and maintaining physical distance. So I'll end here and turn it over to Nicole for a very interesting, in-depth discussion about adolescence and development.
Thank you. That's all very, very interesting, and I think that there's so many things that you are sharing that mesh well with what we understand about adolescence and adolescent development. We all have had experience with teens, either in our personal lives, in our work, in the community, and we know that adolescence is a time of significant change in so many domains of development. So 3 main big areas that I want to talk about are the physical changes, cognitive changes, and social emotional changes. And of course, this is just the highlights, a very short version of what I think is important to share with you all today to help us understand adolescents better and their behaviors around COVID. But hopefully we can focus on the most salient parts of these areas of development to understand adolescent motivation, their choices, their decision-making. And I want to share with you a little bit of research that's just been coming out in 2020 about how adolescents are handling the pandemic. Are they wearing masks? Are they socially distancing? We hear a lot of different things in the media, and while this isn't definitive and things do change from week to week as the pandemic numbers change, it just does give us a little glimpse into what's happening and how adolescents are choosing to handle the pandemic. And lastly, I'll end on how parents and those who work with teens and influence teens can help them make better choices around behaviors to stay healthy. So we know that adolescence, the most obvious thing that happens when kids enter this phase is the growth spurt and the sexual characteristics, the secondary sexual characteristics that develop that are visible. The big driver of this is the hormonal changes that are going on. And one thing I want to highlight about these hormonal changes is the hormone testosterone, which is evident in boys and girls. Many people think of testosterone as kind of a sex drive hormone or an aggressive hormone. And that is in part true, but in the context of adolescence, what is a driver for teens is really status. And what has been found in some studies is that higher levels of testosterone, yes, can lead to aggression if the peer group is deviant to begin with. However, in non-deviant peer groups, that higher level of testosterone can actually be focused for good and to be used for leadership. So we can think about some of these hormonal changes that are happening in adolescence as drivers for status and peer acceptance in their groups. This is a humorous rendition of the teenage brain. This is not scientific, obviously, but I thought it was pretty funny because you can see some of the things that are important to teens: love, rebellion, slamming and punching reflex, judgment gland. So we know there's a lot of, challenging and contrasting and pulling kids in different directions during this time. But getting into a little bit more of the scientific basis, we do know that one of the things that happens in the teenage brain when children are beginning to reach sexual maturity is that there's a heightened neuronal responsiveness. So meaning that the neurons deep inside the brain, particularly in the emotional network, are very excitatory and they're very sensitive. And so what that means is that teenagers have high reactivity to anything that's going on in their environment. You have probably seen them have high highs, low lows, extreme overreactions, and that is in part due to their brain and the way that that's working. So a high reactivity to stress, pleasure, embarrassment, excitement, a lot of social sensitivity. We know kids are very easily embarrassed, and that social drive is critical for them. There's a lot of intense emotions. We also know that this is a very important point to think about, and it kind of frames the rest of our discussion in a way, is that the emotional center in the brain, so deep within the limbic system, is really running strong and it's well developed. This is a part of the brain that develops before some other areas of the brain develop. And this is a strong motivator for teens, right? And it explains why some of these emotions are running so high. On the flip side, the prefrontal cortex, which is located right in the front of the brain behind the forehead, this is kind of the conductor of the orchestra. And we know, and this has probably been in the papers and you've read about it, is that the prefrontal cortex doesn't really become fully developed until the mid-20s. And so what we have is really an imbalance, and it's a setup for some problems. So you can see here in this slide that we have kids entering, 12 to 14, where they're sensation seeking, there's a huge jump. And sensation seeking means that desire to engage or be part of risky situations that give us a lot of reward and a lot of pleasure. It doesn't necessarily mean their behaviors are going to be doing those things, but they want to be part of that, right? It's a drive from deep within the brain. On the flip side, here's the imbalance, is that the cognitive control network is really not developed. So you have a lot of impulsivity and a lot of poor behavioral decision making. So around the age of 14, you can see that there's a high risk, right, for engaging in behaviors that can be quite dangerous. Some other cognitive changes that are going on in the brain for teens. we have an increased ability to reflect on our own selves and on what other people are thinking. You have probably heard teens, maybe over the phone, if they're still talking on the phone, or if you're reading text, I heard that she said that he didn't know she went to the party. Okay, so that is extreme example of recursive thought, and kids are able to have this metacognitive awareness, this reflection on themselves and what other people are thinking. That's great in social situations for them to understand those complexities. However, it creates kind of this navel gazing that we see with teenagers, right? And there's an imaginary audience. I'm hyper-focused on me, so everybody else must be hyper-focused on me, as well as a personal fable. If everyone is looking at me and I'm the center of attention, I must be special, unique, and really nobody understands what I'm going through. So these are some of the cognitive changes that lead to some of the behaviors that we're seeing in adolescents. Also, their abstract reasoning is really taking off. Teens can reason almost as well as adults, if not better sometimes. So they're able to imagine alternate ways of doing things, alternate ways of being. You know, teens are highly critical of the way things are, and they don't hesitate to share that with you, in the family or with the world. They want to solve the world's problems. They have idealistic ideas, and they're highly critical. And lastly, although all of this cognitive change leads to better reasoning skills, we know that they have difficulty inhibiting impulses, so their decision-making can be limited. So let's talk a little bit about decision-making. We know we have a setup that's a problem. There's high sensation seeking and low behavioral control. They do have better problem-solving skills, but they really don't have experience. So as adults, we can rely on just decision-making, which means that we've had loads of years of experience where we can kind of quickly ascertain what's happening here and what are the potential consequences, because we've experienced this before. Teens don't have that. They really don't have a good understanding of pros and cons, and they can't rely on gist. So consequently, teens are struggling to make really sound decisions. In addition to the impulsivity and risk-taking, we know that they're enticed by immediate reward. They're swayed by emotion. A great example is there are times when you may present reams of data to a teenager. Well, this restaurant has, 100 5-star reviews. And the teen says, well, I don't want to go there because this girl on TikTok said it really stunk. And that's the decision that teen is going to go with, because they just don't weigh things the same as maybe adults would. There's also a drive for social acceptance and status. And a big concern is a lot of times if there's no harmful consequences, so let's say they go to a party, as Amira was talking about, and nobody gets sick that time, there's no harmful consequence, it adds to a sense of invulnerability and it impacts their decision-making next time. So what can we do? Teens need parents and people who they look up to be firm and give them guidance and give them limit setting in a warm way so that they can understand. How do they understand? They need to feel in control and feel like they're making the decision for themselves and making their own choices. It can be tricky, and parents, I think, can approach teens in this way, but it takes a lot of work. And it takes a lot of mental acrobatics, I think, on the parents' part to resist some of the impulses to say, I told you so, I know better, and that's not the way to reach a teen. Lastly, I want to talk about, before we move into some of the research, I know there's a lot to cover, I'm trying to move quickly, some of the social and emotional tasks of adolescence. What are the 4 main things to remember about what adolescents are trying to accomplish in this developmental stage? To stand out, to fit in, to measure up, and to take hold. And what does this mean? To stand out is to develop their identity and to pursue their autonomy. To fit in is to find a group that matches with their beliefs and to gain acceptance by this group. To measure up is to achieve something, to develop skills, to feel confident and good about yourself in that realm. And lastly, to take hold is to make some commitments and make some choices about your goals in life, the activities that you value, and the beliefs that you have about the world and yourself. So I don't want to spend too much time on this. We can keep moving. So what are teens' reactions to the pandemic? What is the research showing recently? Are they following health guidelines, and how can we promote teens' well-being? This is a word cloud from a recent research publication, an article that was done in Portugal, actually, with over 600 teens. And you can see the larger words are kind of endorsed more frequently by these teens. The first thing that comes out, right? Friends. We know that friends are critical, and we know that friends impact teens' decision-making. We also see, as Amira was saying, anxiety, depression. There's also things like family, routine, health, exercise. These are all the things that have been important to teens over the course of the pandemic. The pandemic has created, I think, in all of our lives, some positives as well as negatives. I think that, so this is what the teens are saying, that the positives have given them some more freedom, some relaxation, a chance to hit the reset button and get off that treadmill and stop working and running so hard. They're valuing relationships, valuing friendships, and actually strengthening some friendships in a different way. However, you can see that the negatives are pretty much outweighing the positives for many teens. We have less productivity, physical issues, more homework, mental health issues, feeling lonely, family disruption and family discord. So, you know, there's pros and cons, obviously, to the effects of this pandemic. But it is good, I think, to understand that adolescents can see both. It's not all negative. Another study that was conducted in the end of March here in the U.S. asked in the past week, so they wanted to find out, are teens socially distancing, and what are your motivations for socially distancing? So how much were they? And again, this is the end of March, not as recent, but we do see that a lot of teens are socially distancing a great deal. Now, I know that recent research, and Amira, you probably are very familiar with this, but we know that social distancing from the spring to now in the fall and winter has gone down. So not as many people are socially distancing. We're having more gatherings. So this data may have been has changed over some time. And this is not really about mask wearing either, but this is what a snapshot looked like back in the end of March when the pandemic hit. And what is motivating teens to socially distance? It's not that different, I think, than most people's motivations to socially distance. We have a couple different reasons why we choose to do this. One are pro-social motivations, so not wanting to harm others, and it's a social responsibility that we all have. Two is control motivation, so this is being put on lockdown or parents saying, I can't go out of the house. And then one that I didn't list here, a third, though, is autonomous motivation. So the feeling like I don't want to get sick. So it's kind of like for personal issues. And so here's a list of some of the reasons, the motivations why teens were engaging in social distancing. And they could pick more than one. But you can see at the top of the list, there is a lot of pro-social motivation that adolescents have when it comes to choosing to socially distance. The other one is parents are making me and being on lockdown. So I feel like what this is showing us is that there's two kind of pieces to this puzzle, and you can move forward to the next slide. So teens who said that it was socially responsible, were on lockdown, or whose parents were making them, were engaging in more distancing than teens who didn't give those reasons. So we're finding that both pro-social desires and limitations on freedom contribute to adherence to safety measures. So I feel like teens need both to make decisions that are helpful to them and to society. So how do we use the research findings and what we know about adolescent values to encourage compliance? We have to remember that teens have a desire to and need to stand out, fit in, measure up, take hold. They also have some poor decision-making and impulsivity, which means they need some of that put on them by the people in their lives. So we need to be their frontal lobe sometimes, right, to help them with decision-making and impulse control. They also have prosocial desires to help them make better choices. So this is easier said than done. And all of this, the foundation of these relationships and behaviors that we have with our teens, the foundation is laid back in infancy, toddlerhood, and early childhood. So, hopefully we've been working in this direction and leading up to this moment for a long time, but teens need to feel heard and they need to feel like their opinions are valued. We know that if we tell teens, don't do it because I said so, we know that that doesn't work, right? They have this tendency to go against authority. It makes them want to do it less. I know every time I tell my daughter, don't forget to practice your piano, she says, Mom, every time you say that, it makes me want to do it less. And there are studies that show that activations in certain areas of the brain when parents remind kids to do things, the nagging, it activates anger. It activates rage. It doesn't activate the desire to do those things. But we know that when kids are able to make their own choices, that activates the rewards and motivation center of the brain. So it sounds counterintuitive that we need to let teens make those decisions because they don't always make great decisions, but we need to be there to guide them, to help them, give them information, listen to them, and expand their thinking so that they can make good decisions. We also need to model good behavior, right? Practice what you preach, walk the walk, and that can be hard to do because we're all pulled in a million directions and parents are stressed and there's a lot of strain going on right now. So as best you can. But, these are the ways I think to reach teens in general and to help move them in the right direction during this pandemic. And I think this can be applicable to many other aspects of teens' lives and parent-teen relationships as well. So I'm going to end that there.
Thank you very much for that. It's eye-opening, and for people who are parents and engage with adolescents, it explains a lot, so thank you. We do have a few discussion questions, some of which we've already touched on in your opening remarks, and we are accepting questions via the chat, so now's a great time if you do have a question to enter that in here. So one of I think the interesting facts is the fact that children are not, the mortality rate for children is quite low, yet they are frequently the spreaders of this virus. How do you think that factor changes people's opinions and their actions? And I think this is a question for Amira first. If children were affected by this, if the mortality rate in children were different, do you think that the approach the public is taking would be different?
Right. I think if the mortality rate looked different, our approach would be very different. We wouldn't be discussing having our kids socialize and have in-person activities. There's a few challenges I see here in the U.S. With our approach to schools and with our approach to the pandemic around adolescents. I think first we have to recognize that the adults messed up, right? We made the mistake in terms of how we addressed COVID from the beginning. The messages were very mixed and confusing, and they continue to be. There was no national mandate. There's no unified or cohesive strategy. And so the adults in their lives are confused and are doing all kinds of stuff. We also have a very limited healthcare infrastructure, right? And you can't deny what that effect has on populations, especially those who are struggling. They don't have, lots of populations don't have healthcare access. they are not going to approach a healthcare facility if they have cold symptoms. You saw that there's a lot of fear of getting COVID from healthcare facilities, especially among low-income and minority populations. There's a strong history there for why that is. And so what's going on in the households with the adults is, I think, directly impacting what we're seeing in the adolescents. And we've understood for a while that the mortality rate among children and adolescents is lower than the adults, certainly, especially the older adults. But the role that the adolescents play in transmission was less understood. And part of that is, in the very beginning of the outbreak, a lot of schools closed down globally. And so then in our hemisphere or in our country, in the summer, you also had very limited in-person activities. And so that meant that our understanding of the role of adolescents in transmission was really limited by the science and the observational data that we had. And it was only really this semester in the fall that we started to learn more about the infection rate among adolescents and how many of them are asymptomatic or pre-symptomatic when an outbreak is traced back to adolescents. So I think we have to just sort of recognize all of these different things are really linked together. And hopefully we've learned enough that our reaction in the spring will be better than it has been over the last year.
Thank you for that. Now, Nicole, you did mention some of the consequences for families, their stress levels, and how that has affected their decision making. What kind of outcomes and consequences have you seen on how families are making decisions?
Sure. I think it really comes down to how much can a family hold at any one given time. I think it also depends on how many kids are in the household, what the ages are in the household, what the demands are with the parents' jobs, if it's a single family home, dual family home, and also, what is the income level, because we know low SES families have this situation much harder than other families who are able to afford assistance, help, et cetera. So, I think it really varies, depending on a lot of different factors. We could go on from, the financial strain, we could go to mental health concerns, we could talk about academic fallout from this, we could talk about parents' jobs suffering, and missing, opportunities for growth financially because of the responsibilities of childcare at home. We could talk about women's, the inequity with women and bearing the brunt of this and having to do kind of this two-factor job situation where they're educating kids or at least tutoring and helping kids at the same time of having jobs. So there's a lot. It spans so many different areas.
Many opportunities for future research, for future public health outcomes research. And I believe we did mention mental health and substance use in Nicole's comments. So I think we can jump to this last discussion question here. Amira, how do you see the availability of the vaccine changing attitudes and behaviors of families, of adolescents? I think it's a good question for both of you, actually.
Yeah, right now we are seeing very polarized reactions or vaccine acceptancy issues related to the vaccine. So on the one hand, you have individuals who are saying, I want to get vaccinated. I want to get my life back. I want to go back to life as normal or as it was. And then you have individuals who don't want to vaccinate their children, the anti-vaxxers, and there are individuals who are really hesitant about this vaccine in particular because they view it as being too politicized. And they're questioning if it was, really put under a rigorous clinical trial process. And so I think in the U.S., where we oftentimes have, very low uptake of the flu vaccine, some years like 30% of the population will get it. I think we have to figure out what we're going to do if a very low percentage of our population ultimately gets vaccinated, decides to get vaccinated. That completely changes what the vulnerability of the adolescent group, of our population as a whole, has. And so we need to understand a lot more about what are the attitudes and behaviors among the different populations in the U.S. towards vaccines. What does the vaccine hesitancy look like? And then we really need to figure out what the messaging around vaccines should be. What is the most effective type of message? And that's going to come from marketing and communication experts, right? They're the ones that are going to understand this, the ones that understand psychology and how the brain functions. I shared an example of how very well-meaning public health scientists and epidemiologists, they're often not the ones to go to for the communication campaigns, right? And it's really critical. I mean, we've seen what a mess poor communication does when you're trying to ask your population to do something like wear masks. And if we didn't do that right, I'm really worried that the vaccine coverage will be very low. And if that happens, next fall may not look much different than this fall was.
Yeah, I mean, if I could just add in a little bit on the psychology side of that, I'm not a decision-making expert, and that's not my field of psychology, but some of the things that I have read about public campaigns, to get people to do things that are, let's say, better for the environment. In fact, there was an article in the not the Washington Post, the New York Times just the other day about using the example of staying in a hotel and not being asked to reuse your towels rather than having them get replaced every day. And what actually made a difference was not the pleas for the environment. It was the fact that 25% of our guests are already choosing to reuse their towels, or 75% of our guests, whatever that magic threshold number was. And that experiment actually yielded results where people were choosing to keep their towels and not have them thrown into the wash every day. And so, it just speaks to kind of how is this public message going to go out and how are we going to change people's behaviors? Part of that, I think, is there's a little bit of pressure when everybody else is doing it, maybe I should do it too. If you throw litter on the ground and nobody's around, you're going to be more likely to throw litter on the ground. But if you have somebody who kind of watches you out of the corner of their eye, research has shown you're more likely to take that flyer off your windshield that you get under your wiper blade and put it in the trash and not throw it on the ground. So, I think it needs to be examined, but there definitely is research out there that can help with this public outreach campaign. I
want to share this short story. When I was working at the CDC, there was an exposure of rabies at a school. I think it was a middle school. And basically, one of the parents had found a dead bat, brought it to school as a show and tell thing, and then a lot of the kids touched the bat. The bat was rabid, right? And so what then happened was the health department had to go in and do an investigation and figure out who was truly exposed, because then they had to get the rabies shots. And so in the beginning of the investigation, right, a lot of the kids were angry and stigmatizing the child who brought in the bat, right? Okay, fine, understandable. And then no one wanted to have anything to do with rabies, and they were kind of like not truthfully answering some questions for the outbreak investigation. And then somehow something shifted, and then all of the kids wanted to say that they were exposed to this rabid animal, and they all wanted the vaccine. And like then it went to the other grades that we knew, right? They had no contact with this bat, but it kind of like was a really interesting lesson in how the peer pressure could completely change how these young kids or these adolescents are reacting to things, and how they may, perceive a public health threat, and, how they would then say, yes, I want the vaccine, and it just kind of trickled throughout the school, right? So I think there's a lot to learn there, but, I haven't seen a lot of in-depth analysis in that area, but we do see a lot of work in how do you get kids to, buy Coca-Cola or buy Aqua Pops or whatever it is, right? So it's out there, and those are the folks we need.
Absolutely. Yeah, I was going to say that sometimes it takes, we know that teens place a lot of worth in getting a positive message or a positive acceptance from people whose opinions they value. And I guess that is the key. It's like, whose opinions do they value? And oftentimes those are other teens who have leadership roles in school or are viewed as leaders of groups. And that can be positive or negative, we know. But I think that part of the catalyst for change can be using other peers who are well respected in their community and in their school environment to send the message across. Coming from adults, usually, to do this because it's better for you or good for you isn't the way. It's kind of using a medium of other peers to help them see everybody's doing this, or these important kids in my school are doing this. Maybe it's cool or okay to consider doing it too.
Some good thoughts there. Couple of questions coming in, some good questions coming in from the audience. With males in general being greater risk takers than females, does the approach and messaging for adolescents need to be tailored accordingly?
I think it depends on how much of a risk taker you're talking about. There are kids that operate at the extreme end of that spectrum. And I hesitate to make kind of those overgeneralizations because I think, you know your teen, you know your kid. We have some males who are hesitant, anxious, reserved, and reluctant, as well as females who are, those go-getters who will do anything to to get that thrill. So, maybe it's not just male, female, maybe it's thinking about the kids who are higher thrill-seeking, risk-taking kids versus not. And I think it's a great question because it makes me think about what motivates different kids based on temperament and personality style. What will motivate some will not motivate others. We know that kids who have more of that risk-taking drive need firmer limits. They also need more warmth. They need more consistency. They need to feel more acceptance, not just the rules for the sake of rules, but they do need firmer parenting. Kids who are anxious or more reserved or less likely to take those risks, they might be doing better with giving them a little bit more control to make those decisions, and they might not need such firm, hard limits.
Very interesting. Another question, and I think this could be for either one of you. Is anyone aware of evidence that vaping or smoking among adolescents increases their risk for negative outcomes if they are infected with COVID?
There has been some research in this area, primarily among adults, and there is some evidence that suggests that previous history of smoking or tobacco use is linked in some age groups to worse outcomes. But, again, the new virus, there's still a lot that we're learning.
Nicole, any thoughts on that?
I know that the Fairfax Youth Survey that's given every year to teens in various grades has just recently started identifying vaping as one of those drugs that are used. And so there's not a whole lot of data. I'm thinking about just prevalence rates, like frequency of how often kids are vaping or using electronic cigarettes. So there's not a whole long history or trajectory of evaluating that data, at least in this county, so I'm not sure.
When schools have opened for teens, have there been any types of orientations for parents to help them with their teens' compliance of school rules during COVID?
I do know that there are schools that are obviously in session. We have seen private schools and religious schools are meeting, and we know that Fairfax County has lost 5% of their enrollment this year to families who are choosing to place their kids in these in-person learning environments. I do know just anecdotally that these environments have families sign agreements or they're not permission forms, but an agreement, I guess, or a consent that, they will encourage mask wearing, they will encourage social distancing, they take temperatures, et cetera. But I don't know if there's been any kind of informational session or advice given about how to talk to your kid about, maintaining positive, healthy behavior.
It would be an interesting tip sheet to share with parents and with educators.
Or certainly, or to go on a little workshop tour, right? To share some ways parents can help kids make better choices.
And presumably educators are more aware perhaps than parents are of these developmental characteristics. For many parents, this is probably, for me, it's eye-opening news.
Right.
So what do you each see as the long-term trends that we should be on the lookout for as we hopefully turn the corner and come out of the pandemic?
So I think it's very clear that the disparities that were already existing before COVID related to health, education, development, they are even healthcare access, right? They're going to be worse because of COVID. We're seeing them get worse. This pandemic is just further going to, widen that gap between the haves and the have-nots. And we could see it happening. And I think we really need to ask our leadership to take this very seriously, because that is going to impact the next generation. And, the consequences of that could then, move on to the generation after and after. We really have to do better. We're seeing that already things like suicide, number 2 cause of death in this age group, right? There's evidence that it's getting worse. The mental health, the long-term consequences of this pandemic really have to be taken seriously and addressed. And I think, schools might be might have an opportunity to reach out to all of their students as they come back and provide them with mental health resources, but that's going to take a lot of effort, a lot of resources. And right now, Nicole mentioned that 5% of Fairfax County parents took their kids out of the public school system. And in another webinar, right, the speaker had mentioned that the way the budget works is that we look at the previous year's enrollment and then allocate resources based on that number. Well, that means that if people are going back to Fairfax County and other, public school systems where you've had a significant percentage withdraw their kids this year, they're going to be under-resourced at a time when they actually need more resources and they need mental health programs that they didn't have in place before. And so, it's not okay to do things the way we've always done them. We really have to we have to think more creatively and change the way that we're allocating funding for public schools across the country. right?
Yeah, I mean, I can second so much of that. The haves and the have-nots. I mean, I think, the haves will view this time period as a period of time where they had to make some adjustments. But I feel like the haves can move through this and access resources and bounce back and get back on their feet. The have-nots are definitely going to have effects linger mental health-wise, financially, health-wise. As Amira said, it's really, they're going to continue to fall further behind, and we need to pay attention to that, absolutely. Schools, I will say, have been doing, I have graduate students who are doing work in the public schools as we speak. This whole semester, they've been involved in school psychology services in the local counties. Schools continue to provide mental health services to children and families throughout this pandemic. And they've had to learn some new tricks, right, in how to reach children and provide services through an online format, but that hasn't diminished. Yes, it's changed, but it hasn't diminished. And going forward, they will have to continue to put effort. I mean, mental health has been a huge effort in the schools for the past 5 to 10 years, I would say, since there have been a rash of suicides in our county about 10 years ago. And the state has heard our pleas to increase funding for mental health services in schools, and we have been adding jobs in that area now for the past 5 to 10 years. So this is good news. I think that schools are almost well equipped. They're not fully equipped, but definitely they are working in that direction, and everyone is well aware of the mental health needs of kids now and when they come back.
That's good. That is good news. It's certainly an ongoing concern and an issue. And our most recent webinar prior to this was on mental health. And we did provide a number of resources in that webinar. So if anyone is interested in checking out the slides for that webinar, you will be able to find them linked when we send the recording of the slides to this email. They'll be linked to the same site and available. Well, I have enjoyed this. I've learned so much from both of you. We certainly have our work cut out for us to understand and to mitigate the long-term implications, but I think this kind of information helps all of us do that job better. So thank you very much. And thank you to everybody who joined us. This is our last event for the year. We do have the Chip Rehab webinar series coming up in February, and we will be continuing the COVID-19 webinar series. If you have thoughts on topics that you'd like to hear, please feel free to let us know that in the survey that we'll be sending out after this event. So thank you to our panelists. It was a wonderful, wonderful event, and thank you to everybody, and happy holidays.
Thank you, Michelle. Thank you, everyone. Have a good holiday.